This is inverted vitrectomy. Vitrectomy for severe diabetic tractional retinal detachment with brilliant blue assisted ILM PO under perfluorocarbon liquid. This is the preoperative retinal picture showing a very adherent epiretinal fibrovascular tissue 2 weeks before the surgery. The patient is a phakic diabetic with a very small pupil. Using a wide-angle vitrectomy contact lens, we approach the macular area as well as the periphery. We notice the traction extends to the inferior arcade as well with multiple intraretinal haemorrhages. Peripheral vitrectomy should be performed extra carefully, mainly because of two reasons. The patient is phakic, and the pupil is small enough to trick you when you're attempting to perform a good vitreous-based shaving. You can only do that if you rotate the eye before you move your instruments towards the very periphery, otherwise it is very likely to touch the lens. Endocautery is very useful now, and easily to the optic nerve it gets rather safer, and we can extend it a bit so as to erase neovascular tissue, very active vessels on the way. Notice the lens is pretty clear at all times, and of course you want to follow up the patient for a while, at least before too much opacity could halt your good exam and follow-up. With a macular lens, you get a great view from the fundus for an AFX, air fluid exchange. Of course, you gotta zoom it out before entering the eye so as not to get lost with the backflush and illuminating pipe in the mid-vitreous. With this MAC lens, it is possible to watch hard exudates with edema and also retinal folds involving the foveal area. It is necessary to perform a complete AFX so that enough brilliant blue will be poured into the eye straight towards the MAC surface, of course for a good staining. This is the next step. There is no need to go past the macula, and the arcades are the limits for the good staining of the brilliant blue, exactly where we need it to be for its action. The macula is fully stained. Now that we replaced air for PSS, it is possible to remove some pre-retinal hemorrhages with the backflush cannula around the macular surface. Perfluorocarbon liquid is now injected over the macula. The reason for using PFC at this time is threefold. First, creating a pressure on the macula so as to lift the ILM with more control on it, thus avoiding pulling it too forcefully and causing a retinal tear. Second, PFC weighs on the retina, pressuring in the opposite direction of the pupil in such a manner keeping the retina in the normal position without lifting, thus avoiding any subretinal fluid go subretinal. Also, and thirdly, the same pressure action on the vessels could actually halt inadvertent bleeding, and that's required for a nice visualization during this step of the surgery especially. Using the technique tear and lift, it is easy to grab the edges of the internal limiting membrane after it is removed in a circular fashion, thus relieving those undesirable central tractions. Now that the macula has been taken a good care of, the retinal periphery is approached. A peripheral retinotomy is created to relieve retinal shortening that would probably pull on the central retina and most likely detach it if not made. So that was a safe approach, again avoiding the contact with the shaft of the cutter with the lens equator, tilting the eye towards the retinotomy area right before the retinotomy action. With a great wide-angle vitrectomy lens, you get this amazing overall view from the fundus, and you can actually see the macula and far periphery. And then the laser is started peripherally at the retinotomy sites as well as in a panfluorocoagulation fashion. A direct exchange of perfluorocarbon liquid for silicone oil is the last step of the surgery, and there is no need to rush to remove the PFC, so that every drop of PFC is removed, resulting in a pretty cool attached retina, clear lens, and better outcome. These are the postoperative retinal pictures showing a pretty good macula, some nasal hemorrhage yet to be resolved, and clear media. A plan to remove the silicone oil in the next few months will be carried out. Thank you very much for your attention. We appreciate it.